Hello, everyone. My name is Joao. I'm a specialist in cardiology that work for Virtual Veterinary Specialist, VVS, and I'm providing today the second part of the talk on top tips in cardiology. So as I have mentioned before, this talk was pretty much done after collecting all the most frequent questions that we usually get on how to approach a patient with a heart murmur. We have discussed already how to approach a puppy with heart murmur, and on the second part of the talk, we're going to discuss on how to approach, and this is very important, heart murmur in an adult / geriatric small breed dog. So we are only discussing small breeds, okay? So let's say breeds below 20 kilos, for instance, that are middle-aged or geriatric, okay? And this is very important. So the first slide is just to show you, okay, how we can use auscultation to take a clinical decision, but what is the risk of that clinical decision if it's just based on auscultation, okay? So let's consider just, again, an adult geriatric small breed dog that has a left apical murmur. So the left apical murmurs in these specific type of patient, okay, dogs that are, middle age, above, and small breeds, most of the times we are dealing with a myxomatous mitral valve disease, okay? So this is very important. Obviously, if you are dealing with a myxomatous mitral valve disease, and if the patient is asymptomatic, okay, so we are obviously discussing asymptomatic patients, mostly in this slide, what you really want to know? You want to know whether you need to start pimobendan or not, okay? This is the main thing. So I'm going to just revise with you the ACVIM staging, so it becomes more clear when I'm going to discuss a little bit later on. So for an ACVIM consensus, we have different stages. Okay, so stage A is a small breed that is at risk of developing mitral valve disease, but it does not have it yet. Okay, so let's say ACVIM. Then, they eventually develop mitral valve disease, but they don't have left heart remodeling. So they don't have left atrium and left ventricle remodeling. And that will be the stage B1. In this stage, no medication is at the moment recommended. When that same patient starts to have left atrial dilation and left ventricle dilation, so both chambers dilated, then they are called stage B2, okay? Then it's very important because that's when we start PIMO, because PIMO is very important to start on that window because it will prolong, time to heart failure, which is the stage C, okay? But also survival time, and it will also improve quality of life because it will decrease the time to what we call first event, which is something else like apart from heart failure, like coughing, fainting, etc. So it's very important to not miss that window, okay, the stage B2. But what happens if if the owner, let's say, cannot afford a scan? Because ideally, as I told you, the difference between B1 and B2 is that the B2, both chambers are dilated. B1, you can have one chamber dilated only, or left atrium, or left ventricle, or none of them. The only way of really be sure that the patient is B1 or B2 is combining echo and X-rays, according to the consensus. But the problem is a lot of time because of costs. We can select only one. And if you have to select one, definitely echo, because echo is much more precise, much more accurate in staging than X-rays. It's much more sensitive and specific as well. So that means that these patients will need an echo, okay? But what happens if the owner cannot afford? So if you look into this table, where we have soft, moderate, loud, and thrilling left apical murmurs in breeds where we were expecting to be myxomatous mitral valve disease, and basically divide these type of murmurs, okay, this intensity of murmurs, in the different stages of the ACVIM consensus, stage B1, B2, and C. Okay, and you have the proportion here. So what I want to call your attention is to the soft murmur. Okay, soft murmur is when we have on the old scale, which is the one I still use, I call it old, but I still use it, is the grade 1 and grade 2. So murmurs that are quieter than the heartbeat. If you pay attention, pretty much if you have a soft murmur, you are 90% kind of certain, let's say, that you are dealing with a patient that is in the stage B1. So that does not require pimobendan yet. So that's good, because if the owner cannot afford, you can tell that the owner. So you can say, maybe you have 90% chances, let's say, of being a patient that does not require pimobendan. But if you use only that with pretty much every single patient, you're going to miss 1 in 10 patients with a soft murmur that in fact are already requiring pimobendan, because 10% more or less are already on the stage B2. What is the problem of doing that? At the moment, because we have a very nice study called EPIC trial, it showed that pimobendan in fact can, if we compare 2 patients that are on stage B2, one takes pimobendan, another one doesn't take anything. In average, let's say the one that takes pimobendan can live more or less, 15 months more. So this is in a very simple way of explaining. But this 50 months is a lot, right? So some 50 months is more than sometimes oncological treatments. So the owners get a little bit upset when they found out that the patient that should have started pimobendan and they didn't, and that the scan was not proposed by then. Okay, so what I want to highlight is, if it's possible to afford a scan, I think it's worth to do it, because you don't want to miss 1 in 10 dogs that need pimobendan. And if he does not get pimobendan, right away, he already lost some months to live, okay? So this is what I want to call your attention to. Then also call your attention that if you have a thrilling murmur, okay, then you are really, really certain that, almost 100% certain that that patient will need pimobendan. Because if you look into this plot, okay, like maybe 5% of those patients with a thrilling murmur, so you can feel a thrill. So usually we think it's really something really advanced, okay? But 5% will eventually have a stage B1. So in fact, does not require pimobendan, okay? What is the problem of this? So if you, based on auscultation only, in a patient with a thrilling murmur, maybe, in 5 patients in 100, not a lot, but you might start pimobendan when in fact might not be required, and that obviously leads to an excessive cost or an unnecessary cost to the owner. Okay, so if you are really on a budget with the owner, you can use this, but I still recommend to do scan, because you don't want to miss 1 in 10 with the soft murmurs mostly. If it's a moderate or loud, you have no idea. It can be pretty much of the stages. Cool. So in conclusion, okay, soft murmurs, more likely stage B1, do not require pimobendan, and you can potentially suggest to the owner, if he cannot afford a scan, okay, let's wait until the murmur gets moderate, okay, until the murmur becomes like a 3 out of 6. I do not tend to do that. I do tend to recommend, because I don't want to miss that 1 in 10, let's say, okay? So I prefer to not miss those, and so I still recommend, because I have some patients that I really thought they're going to be stage B1, and they were already stage B2. And I thought, retrospectively, I could have done something really wrong. And usually, just obviously to explain to you as well, the pharmaceutical companies are nowadays really good in, if owner goes to internet, very easily can understand that the advantage of getting pimobendan and the timing as well. So I have owners already that went back, when I saw them for the first time, they came because they wanted to know whether in fact needs pimobendan or not, and then they can become a little bit upset if they realize that they lost already the window where I should have used pimobendan, let's say, okay, because the original vet used only an auscultation and has not proposed a scan. So that is not often, but if we could avoid it, and if the owner can afford, let's definitely go ahead with the scan. Moderate murmur, we don't know. It can be stage B1, it can be stage B2, okay? So we have no idea whether it needs pimobendan or not. Definitely we need an echo on those ones, okay? Then loud murmur, okay? Sorry, I said moderate murmur, we don't know, but loud murmur and thrilling murmur, okay? It can be any of these stages as well. I told you that thrilling murmur, if it's a thrilling murmur, you have 5% maybe of cases that is still a stage B1. So most of the time, stage B2 and C, they will need pimobendan anyway. So if you use a thrilling murmur, we're very certain that that patient will need pimo anyway. But the moderate and the loud murmurs, you really don't know. So what I do tend to advise in those cases, you need echo and X-rays, to be sure. But then there's this very common question. Should I start it now because the scan will be only done in 2 weeks or 1 week, or should I, just not give it? So what I usually say is, if the patient is at that moment unstable, I need to start. Okay, you need to start, because if he's a loud thrilling murmur, okay, I think at least you need to start. Maybe, if he's unstable, probably has already clinical signs. If he has clinical signs of heart failure, he's probably a stage C. And if he's a stage C, as I said, he needs pimobendan anyway, and on top of the furosemide as well, okay, because he's unstable. So probably has a cardiogenic pulmonary edema. But if he's an unstable, if he's a stable patient, then what I prefer as a cardiologist that is going to scan, okay, and also to try to save money to the owner, is I prefer to not, that the patient does not have anything given before the scan, if the patient is stable. Why is that? Because if you give pimobendan before the scan, you might decrease the size of the left atrium and left ventricle. And when I'm going to see that patient, I'll see a normal heart, and then I will not know, was that always normal, which means he never needed pimobendan, okay? Or it was just on that little, it was just a mild left atrial dilation, a mild left ventricle dilation, so it will be at very early stage V2, and then because of pimobendan, it went back to a normal left size, a normal left atrial size and a normal left ventricle. And then I don't know, should I carry on with pimobendan? Should I? So most of the times, what I do tend to do, okay, unless it's super obvious that it needs pimobendan, but most of the times I need to stop pimobendan, wait a few weeks, and rescan the patients again to try to really understand how the patient was before pimobendan, because that's really how you should do the staging, okay? So if the patient is stable, I prefer, and if the scan is going to be done just in 1 or 2 weeks, then I prefer for the patient to not have anything, so I can assess it without any interference. So I know that this is a real size. If the patient already have pimobendan, if it's very obvious, if the heart is still very large and very dilated, I know that he needs to carry on pimobendan. But if he's if he measures normal, I never know, was that the effect of pimobendan or it was already like this before? So this will be the difficult question to answer. So also I have here these topics. So basically, I have this question here, okay, which, why is it important to stage a left apical asymptomatic heart murmur in a small breed, small, medium adult dog, okay? So why you don't start with pimobendan in stage B1, okay? So this is also a very common question, why you don't just start in stage B1. First, we don't have any evidence pimobendan works at stage B1, okay? So that means that if you start pimobendan in that, very early stage B1, and obviously because you have not done a scan, so what happened is that patient might be years and years on that medication without being needed. So this can be a problem if one day that patient is scanned and then the cardiologist takes the medication off. If the patient has been on medication that is expensive for many years, the first thing that the owner will be is upset with the first PET. So I had some situations like this, quite difficult situations to manage, to be honest, because I had to take the medication out, and the owners, in fact, I had a funny story where the owner went to the vet and want the money back from all the 5 years of pimobendan. So obviously, this can be really difficult to manage because you cannot just say to the owner, just let carry on, okay? And more years with pimobendan will not be needed, because one day, another cardiologist might find out and will take the medication, and obviously knows as well that we have not done the right thing. So other thing as well, this is quite interesting. So there was, before we were using very widely pimobendan, there is a study, I believe that is a retrospective study. It's not a super strong study, but it shows that some patients that might be on a very early stage of mitral valve disease that started on pimobendan might have developed left ventricle hypertrophy. I don't know if this is what would happen, because it's not a strong study, but in fact, I've seen patients, not a lot of them, maybe 4 or 5, that where I've seen that they were being on pimobendan and it was not needed to be on pimobendan, and in fact, they have quite marked left ventricle hypertrophy. But the problem is that I never know what happened to those patients after I stopped it, because I was doing just a roaming cardiology by then. So maybe if you start too early, also can cause an issue, and this might not be. It's not that it will not cause nothing. It might be in fact detrimental. We don't know about that. And then what is very important as well, by using only auscultation, as I said, you might miss, a stage B2 as I said, 1 in 10 patients that have a soft murmur might be in stage B2. And if you use only auscultation, you will not give pimovendin to that patient, okay? Because you're going to believe that maybe, he has 90% of chances, let's say, of being a stage B1. So just let's carry on monitoring. But in fact, that patient might be in stage B2. The problem here is that if, again, the owners get really upset when they realize that the diagnosis is only done really late in the stage B2, almost close to the stage C, because they, even if you don't tell them as a cardiologist, they will go online and they find out from Boehringer, from SIVA, whatever, that they probably should have given, probably a few years before. So obviously they can get a bit upset because they realize that that patient lost, a few months of life just by missing the stage B2. Okay, so this is important. And then finally, okay, that's what I was saying just before. They get upset when the diagnosis is only done at stage C, because there will be a very common question: would this happen if my dog was seen earlier? And the truth is, it will happen, but maybe it will happen later. And that's the issue here, okay? Because the later can be, as I said before, in average 15 months, okay? So it's quite a lot, okay? Considering that sometimes owners go ahead with the chemotherapy treatments, there will be shorter survival times anyway. So 15 months is quite significant. So this is another reason, okay? And now we have owners that would like to go for the state-of-the-art mitral valve repair, okay? That particularly in UK, where you have 2 centers that can do it. So this becomes more and more important, because although it's expensive, yeah, but there are owners that want to do it. So obviously, if you miss at the stage where ideally the procedure is done, obviously they might not be as good candidates, okay? So they might end up going to these centers and they may tell you, yeah, it's a candidate, but it would be better if you would have come a little bit earlier, something like that, okay? So this is another reason why scanning is important. And finally, knowing really in what stage you are with certainty allows you to also educate the owner much better. And for me, this is like one of the most important things. To have an owner that I can rely on, okay, is halfway to have a patient that lives longer, understands when it needs to be hospitalized, and also understands when we can avoid hospitalization. So I'm going to give an example. In the teaching of the breathing rates, okay, this is very important, because if you are already on the stage B2, I'm already introducing that, that concept of measuring the breathing rates at rest at home. And I told the owner, when he's over, let's say 35 breaths per minute persistently, you need to give me a ring. I want to avoid him to come as an emergency. The less times that they come for hospitalizations, the more money we're saving to the owners, and usually the happier they are, because they can manage these things at home without taking them to the vets. So this owner education is very important. In fact, obviously I don't have a study, but I believe that the owners that were more compliant and really understand more about the condition, they were the ones that I probably think that all going well, these patients will live longer than the owner that probably does not understand the condition or what it needs to look at home. So I think owner education is important, but the owner education depends on the stage where you are, okay? So stage B1, I usually say normal life, come back in 6 months, or let's say, or 9 months. But for instance, stage B2, I start to introduce much more information for them to be, paying attention, and try to save also some work to, as a general practitioners, as cardiologists as well. Thank you so much. I hope this was also helpful. Ultimately, the idea is to pass the message that scanning is in fact the best thing to do, and you can use these little tips on auscultation if the owners are really, really, really on a tight budget. But don't use it as a general rule, because you might miss an owner that really wants to go ahead with investigations, and you cannot just assume that might not have money or something like this. So definitely suggest a scan always, and then if there is a really tight budget, you can potentially use these, warning the owners about the limitations of taking a decision just on auscultation. Thank you so much, and I'll see you on the third part.